5 NCLEX questions of the day with strategies and rationales. Question number 1. A client with type 1 diabetes has a prescription for 15 units of glargine at night and insulin Lispro on a sliding scale. The client's blood glucose is 170 mg per deciliter at 2200. Which action should the nurse take? Here is the medication prescription for Lispro sliding scale. Before we look at the answer choices, let's read the question again. The two medications, the question is, asking are glargine and Lispro, which are both insulin, but what types of insulin are they? Glargine is a long-acting insulin that releases slowly in the body to keep blood glucose level consistent even during fasting. It is usually a daily dose and it does not depend on the blood glucose level, so we should give the 15 units of glargine no matter what. Lispro, on the other hand, is a rapid-acting insulin, and it is usually given with meals or according to the glucose level. In the given information, we can see that Lispro is ordered as a sliding scale based on the glucose level, which is 170 mg per deciliter. Based on the scale, 1 unit of Lispro should be given. And the question is asking for action based on the given info. Let's now review the answer choices. Aid. Give 15 units of glargine and 1 unit of Lispro in 1 syringe. Yes, we should give 15 units of glargine and 1 unit of Lispro, but can they be mixed in 1 syringe? The answer is no, because glargine is long-acting, and long-acting insulin should never be mixed. For an answer choice to be correct, all parts of it should be correct. B. Give 15 units of glargine and 1 unit of Lispro in separate syringes. Yes, that's correct. C. Give 15 units of glargine and 2 unit of Lispro in separate syringes. No, 1 unit of Lispro, not 2, according to the sliding scale. D. Clarify with provider on the 15 units of glargine as blood glucose is only 170. No, remember glargine is long-acting and can be given regardless of the blood glucose level unless the level is super low. But otherwise, normal blood glucose is 70-90, so 170 is considered elevated. Question number 2. A client reports feeling anxious and clammy at 1100. After reviewing the MAR, what action should the nurse take first? Here is the medication administration record. This question is asking for side effects of the medications that were taken 2 hours ago, so let's review metoprolol, lisinopril, and regular insulin. What are these medications used for? Metoprolol ends in LOL, which is a common suffix for beta blockers such as atenolol, propranolol, and the pril in lisinopril tells us that it is an ACE inhibitor. Both metoprolol and lisinopril reduce heart rate and blood pressure. What are the signs and symptoms when a patient's heart rate and blood pressure drop? Yes, they might have dizziness or chest pain due to decreased cardiac output. What about regular insulin? As we recall from the insulin video, regular insulin peaks at 2 hours, and that's when patients are most at risk for hypoglycemia. What are some manifestations of hypoglycemia? Yes, patients can have symptoms of tachycardia, diaphoresis, tremor, sweating, and anxiety, which sound like what the client is experiencing in this question. And remember, beta blockers such as metoprolol and propranolol can mask symptoms of hypoglycemia such as tachycardia and tremor. Now we know that it's probably the regular insulin that's causing the anxiety and clammy skin. Let's review the answer choices. A. Check heart rate and blood pressure. B. Check blood glucose level. C. Give 4 Oz of orange juice. D. Notify provider. Okay, we can eliminate A because it does not have anything to do with BP and heart rate. B, C, and D are all correct things to do for hypoglycemia. But if we go back to the question, it is asking for the first action to take. As we remember in the nursing process, assessment should come before intervention unless the question is specifically asking for an intervention or a priority action, which is not the case here. So we can eliminate C and D because they are both interventions. So the correct answer is B. Check blood glucose level. Question number 3 is piggybacking off of question number 2. The client's blood glucose level is 75. What should the nurse do next? Note that we already did our assessment. The next steps in the nursing process are analysis, planning, intervention, and evaluation. Let's review the answer choices. A. Recheck blood glucose in 15 minutes as the hypoglycemia is defined as less than 70. B. Give 8 ounces of low-fat milk and crackers. C. Give 8 ounces of high-fat milk and crackers. D. Give dextrose 50 IV push since client is symptomatic. It looks like all the answer choices are interventions. So let's go back to the question. Blood glucose is 75, which is still within the normal range of 70 to 90, but at the lower end. And most importantly, the client is symptomatic, so we should definitely do something about that. So, answer A would be incorrect, as we want to give this client some sugar immediately, either orally if he or she is awake and can eat, or intravenously or intramuscularly if he or she is unconscious, or NPO. So answer D is incorrect. That leaves us with choice B and C. Is it better to give high-fat or low-fat milk? The answer is B, low-fat milk, because high-fat or high-protein can slow down glucose absorption and should be avoided in hypoglycemia. Common high-carb foods include juice, soda, crackers, oral glucose tablets, and low-fat milk. Question number 4. Which client is most at risk for hypoglycemia? A. Client who received 8 units of Lispro with a meal 30 minutes ago. B. Client who received 4 units of Lispro for blood glucose of 200 per sliding scale, while NPO 30 minutes ago. C. Client who received 10 units of Detamir without meals 2 hours ago. D. Client who received 4 units of regular insulin with meals 2 hours ago. As mentioned earlier, hypoglycemia occurs when insulin reaches its peak. Recall from the insulin video, the peak time for rapid-acting, short-acting, and intermediate-acting is 1 hour, 2 hours, and 6 hours respectively, and no peak time for long-acting. Lispro is rapid-acting that peaks in 1 hour, so we can eliminate choice A and B because it's only been 30 minutes. Even though client in choice B is NPO, the Lispro is given to correct the glucose level of 200 with or without food intake. Detamir, just like glargine, is long-acting and does not have a peak time, so choice C is incorrect, which leaves us choice D. Regular insulin is short-acting and peaks in 2 hours, which puts the client at risk for hypoglycemia. Question number 5. The nurse takes care of a client with newly diagnosed type 2 diabetes. Which statement made by the client is correct? So we are looking for a correct statement about type 2 diabetes, and remember all parts of an answer needs to be correct for that answer to be the right one. A. I should massage the site after insulin injection for better absorption. That's incorrect. Clients should avoid heat massage and exercise of the injected area, which can increase absorption rate. B. I should give myself insulin injection on my lower abdomen for better absorption. Although the abdomen is a good spot for sub-EQ injections, injection sites should be rotated to avoid formation of scar tissue. C. I should give myself insulin injection 2 finger lengths away from the belly button. That sounds correct. D. I can give myself insulin injection on the top and inner area of my thighs. That's incorrect, because it should be the top and outer area of the thighs, not the inner. Thanks for reviewing the questions with me. If you want to see more NCLEX questions, please like, comment, and subscribe. Thank you.